Good. So welcome all. I want to take you through essentially what the Hub has accomplished this year. So the Hub has accomplished several milestones this year, and the major success we found is that using our knowledge products across the various venues to customize and amplify the message on value is incredibly useful. So this year we kicked off with the Hub's Innovation Series, where we had a closed door session on provider payment models. Several Hub members contributed, including the USA, Australia, and Singapore, so thank you for that. The output of the lab contributed to a paper that the OECD then presented and contributed to us later in the year, which codified the case studies that were kicked off in the lab in February. And in September, we officially launched that OECD collaboration paper in a public webinar. And so we had experts from academia and the OECD speak to the topic of provider payment models. And we saw incredibly high engagement from the audience. So another key piece of work for us this year was a regional series on value. And this work aimed to create a baseline or a state of play for the state of value. And the focus this year was the Middle East and North Africa. So the study drew on healthcare experts from Saudi Arabia, from the UAE, Oman, Qatar, Bahrain, Kuwait, Egypt, and Algeria. So it was quite a wide-reaching study with this extensive geographic reach. And we partnered with the Global Initiative on Health and Economy to respond to the fact that there was limited research and understanding on the state of value-based care across the MENA region. And so the study is the first of its kind, and it looked really to identify specific barriers and opportunities in unlocking value in the region. And in March, we took this work and we ran a closed-door session with the Gulf Health Council with their deputy ministers on value-based care. And as policymakers, there were varying levels of knowledge and value, and the paper really helped to focus the discussion on opportunities within region. The paper was officially launched in October at the Global Health Exhibition, and we saw 500 plus people attend our panel session in which Dr. Reem gave the keynote and Abele moderated our panel of regional and international experts. And the engagement was tremendous. The session ran over. We actually couldn't take the number of Q&As that were posed to us, and it was really indicative of that appetite for more knowledge and products around value in the region. So looking forward to 2022, given the success of this specific project, we're planning to continue the series, but now with a focus in Central and Latin America. And so we have a preliminary list of countries that include Mexico, Argentina, Brazil, Chile, and Colombia. And given the interest in this work, specifically from that region, as well as the Brazilian presidency in 2024 of the G20, we think it's incredibly well-timed. So moving on later into the year, throughout the year, the Hub engaged with the G20. And it's been really excellent working with the Indonesian presidency. We moderated a side event with 3 health ministers as part of the presidency agenda. And so we were invited as an expert to facilitate a dialogue between the public and private sector, specifically focused on bolstering pandemic preparedness. His Excellency Minister Budi chaired the roundtable and has continued to be such a fantastic supporter of the Hub. And emerging from that event and the G20 presidency, our G20 knowledge product for this year continues to explore value as a means to achieving pandemic preparedness and to achieving that resilience that's been so topical in the G20. So the focus of the briefing that we'll release is a build on our previous work, looking at what I just mentioned, but with specific reference to the pandemic fund, given that that was one of the major outcomes from the Indonesian presidency this year. And we'll be releasing that in late December, early January. So also in November, the Hub team traveled to Cambridge, Massachusetts to contribute to several sessions at Harvard University's Chan School of Public Health. And so this 3-day executive course brought together clinical leaders from all over the world to upskill them in value. And we drew on case studies from the Hub membership as well as the MENA paper. And that's something that we continue to hope doing, is to drawing from all of you and then be able to showcase those types of case studies in that type of forum. And finally, in December, the Hub ran a session on value-based care and its link to patient safety for the World Health Organization. So our key message was that patient safety and value-based care are clearly linked, and they're both contributing to improving outcomes. And in this specific event, we saw clinicians from all over the region specifically interested in value as a means to propelling and achieving patient safety. So as you can see, we've had a busy year, and this model of leveraging our knowledge products across different forums is what we'll continue to do in 2023.